Our dental health. We see to it on a normal basis. Visits to the dentist's office twice a year and good oral hygiene. But in spite of all our efforts, serious problems may still arise. One of the most frequent problems is the receding of the gums. In other words, a progressive detachment of the tooth from the gingiva. The standard treatment consists of surgical procedures, but tonight we will talk to you about a different approach to this disease, which attacks the main source of the disease, microorganisms, the identity of which are not commonly agreed upon. An ecosystem, organisms living, relying upon one another, and sharing the same environment. Here is another one. This one is microscopic. It is formed of millions of bacteria of all kinds, amoebas, fungi, and even viruses. This ecosystem is the one of a mouth. Mine, yours, everyone's mouth flora. In this jitterbug waltz, there are the good ones and sometimes the bad ones. Let's hear an expert's opinion about this.
Normal flora is very important because microorganisms which may be regarded as beneficial are eliminated from our mouth cavity. The resulting problem, environmental bacteria, will penetrate the oral cavity, and certain bacteria, possibly pathogenic, will invade the tooth surface, the gingival sulcus, and these bacteria will then likely cause infections.
Daniel Grenier, a microbiologist at Laval University's research group in oral ecology. His passion? Bacteria of our mouth. According to him, even our own mouth flora contains bad bacteria causing mouth disease. These bacteria appear when our mouth flora is out of balance. The reason for this lack of balance, poor mouth hygiene, an immune system deficiency, or, for example, when we take antibiotics, which attack the good bacteria of our mouth flora. When such is the case, periodontal diseases, those of the gums, appear. They are very widespread. They attack 60% of the population. The tooth is a prey of choice for bad bacteria. There are those which cause cavities, but there are numerous others which attack the gingiva. First, a plaque is formed on the tooth. Then, these bacteria attack the gums and cause redness and inflammation. It's gingivitis. If we do not intervene, the situation runs the risk of deterioration. Therefore, these bacteria, living without oxygen, penetrate under the gums and form a pocket of infection. As a result, bacteria attack the tooth, the bone, and the gingiva at the same time. The gums will gradually recede. This is periodontitis. Finding the culprit is not an easy task. We begin by drawing a dental plaque sample that we mix with a drop of water.
It's extremely difficult as far as I'm concerned. If I were asked to identify pathogenic bacteria from a dental plaque sample test, I'd be totally incapable. These bacteria all look the same.
To find the culprit, we must run biochemical tests to identify the genetic codes. In all periodontal disease cases, we find numerous bacteria. One in particular, Porphyromonas gingivalis, frees substances causing the disease. This, at least, is the researcher's explanation.
Then, the microscopic examination will be done.
A clinical researcher, the dentist, Mac Bonad, does not share this opinion. He does not believe that this bacteria is the cause of periodontitis. When a patient, such as Rosa Galigo, arrives with a gum inflammation, Dr. Bonad also starts by drawing a dental plaque sample. What Dr. Banaya looks for and finds in all cases are not bacteria, but rather a parasite, an amoeba, the Entamoeba gingivalis. This amoeba is in fact a big parasite. According to Dr. Banaya, there is no doubt that the cause of periodontal disease is this amoeba and not bacteria.
The parasites are always the common factor. They are always present, and the problem that I have is that as soon as I get rid of these parasites, the periodontal disease disappears. In all cases, there is no exception.
Dr. Banaya is inspired by the work of dentist Trevor Lyons from Ottawa. For 20 years, this researcher believed that by eliminating the amoeba Entamoeba gingivalis, a patient could be healed from his periodontitis. To do so, a progressive treatment. First, the patient brushes his teeth with a hydrogen peroxide solution. He then applies a powder base of sodium bicarbonate to his gums, Torrance powder.
When the patient has done this regularly, within a month period, he realizes that the bleedings have considerably gone down. He has better breath, etc. And then we proceed with the second phase of the treatment, which will require a more sophisticated or elaborate medication.
We then apply an antibiotic cream directly to the gingiva afflicted with periodontitis. If this step is not effective, the dentist will then prescribe a conventional antibiotic treatment. After a treatment of a couple of months, Rosa Gallego, along with the majority of patients treated by Dr. Banaya, have recovered healthy gums. The treatment works. So, who should we believe? The dentist claiming that the culprit is the amoeba, this parasite, or the microbiologists who pinpoint the bacteria? It is a difficult question to answer, because the antibiotic treatment attacks both the bacteria and the amoebas. Both are eliminated.
When we examine the proportions that this amoeba represents in a periodontal pocket, we talk about minute quantities. Then, on the other hand, we have bacteria possessing virulence factors which have been, in fact, associated because they are found mainly in all periodontal cases.
By the means of a very simple procedure, it is shown to be absolutely false and debatable at all times.
Dr. Banaya's practice consists of using saliva to examine plaque samples, whereas the microbiologists at Laval's research group in oral ecology use water, which, as a result, eliminates the amoebas. For Dr. Banaya, the treatment objective is to avoid gum transplant, and ultimately the loss of the tooth that we today replace with implants. His medical approach has the advantage of reducing surgery costs, but presents the disadvantage of using antibiotics, which, in the long run, render the mouth flora resistant. The present scientific information does not prove that it's the amoeba that causes the periodontal disease. But how can you prove that these parasites are the cause of all the damage done to both the gums and the tooth? Do we know what it is at the biochemical level?
This is something I leave up to researchers. This is something I leave up to academics. They do not conduct any research at this level. They're still focusing on bacteria.
The best all-round solution would be the use of an antibiotic which would attack only the responsible bacteria. Dr. Daniel Grenier holds patents for molecules which may prevent bacterial action, but he is far from finding a new remedy. The debate concerning periodontal causes shows that medical research and dentistry have a long way to go before reaching the same conclusions. In the meantime, the research follows its course, and science itself has begun to explore the complex universe of our mouth flora.
Hello, I am Dr. Marc Bonnet. In order to give a better perspective of gum disease phenomena, here are images taken through a contrast phase microscope, magnified 1,000 times, to demonstrate certain related cases. First of all, let's examine the gingival sulcus dental plaque of a healthy 12-year-old child. Notice the low activity rate, the presence of ordinary bacteria, epithelial cells, small coccoid bacteria, very thin, more epithelial cells, long, motionless filaments. Now, this is what we generally find in adults whose gums do not show any bleeding or deterioration of their gums. Notice also the presence of hull-shaped bacteria, rods or filaments, generally not very mobile. Occasionally notice the presence of epithelial cells with their nucleus, and the absence of white cells which are associated with the inflammatory process. Long filaments with coccoids, some fusiform bacteria, epithelial cells, in other words, low activity rate and absence of white cells. We will now focus on a patient suffering from adult periodontal disease. Clinically, the redness of the gums is generalized. There is loss of gingival attachment with 5 to 6 millimeter crevices. Note the mobile bacteria, the presence of spirochetes, the vibrios, and particularly observe the proliferation of polymorphonuclear neutrophils. These white cells of the infection with small granules dance inside the cells. This indicates infectious manifestations, also the presence of the amoeba, Entamoeba gingivalis, this parasite which is present in the majority of periodontal infection types. Isn't it obvious that there is a suspicious presence, or at least disturbing, especially when other parasites of the same family cause diseases such as the intestinal amoebiasis, which is treated successfully by our colleagues using short-term antibiotic therapy? The further along we go with the deterioration and the importance of the periodontal disease, we find more aggressive cases, such as the rapid progression periodontitis, which is described by the following. Once again, using the patient's saliva as a medium, and by drawing a sample from the afflicted area, we find extremely large quantities of neutrophil circulating at the bottom of the crevice, and primarily parasites such as the Entamoeba gingivalis. It slips itself through epithelial cells. Notice the pseudopodia ability to slide between each cell. I would be more tempted to talk about infestation or parasite nests. They are all parasites and also neutrophils. How can this situation be tolerated without anything being done and recognizing a certain pathogenic potential of the amoeba? It would be totally inconceivable to accept this in my own mouth, and more so if I'm suffering from gum disease. Factors in favor of the pathogenic potential are obvious. Major presence of parasites in all forms of gum disease, absence of the same parasite in health. The parasites phagocyte and nourish themselves on the white cells of our immune system. They have the ability to move, adhere, and mobilize the leukocytes. Notice the large numbers. Now, this is the situation of a pregnant patient suffering from pregnancy gingivitis. Notice the significant presence of the amoeba and neutrophils. Watch mainly the parasite's capacity to nourish themselves from neutrophil nucleuses, which should nonetheless protect us from these aggressions. The situation seems to be turning against us. I will let you observe. The neutrophil nucleus will be literally ingested by the amoeba to form a slightly opaque mass inside the amoeba. Many researchers think that this mass is a red cell at the Entamoeba histolytica level. It is, in fact, the nucleus of a white cell that has been absorbed. So when we observe a white cell with its granules which lost its nucleus, we understand that the amoeba has been present. We easily recognize the amoeba with its small concentrated nucleus. We see the spirochetes constantly present. The neutrophils and the amoeba. This is very different from what we observed at the beginning when we were talking about children and adult gingival health. Here, the nucleus is perfectly engulfed in the parasite. We're talking about a process which barely lasts a couple of minutes. And then, the amoeba will repeat its action in a different direction to leave a neutrophil completely hollowed out. Even in juvenile periodontal cases, such as this 7-year-old child, the proliferation of parasites may be observed. Notice the presence of neutrophils, the activity, the motility. We see a smaller amoeba, perhaps Entamoeba histolytica, rather than gingivalis. Who will answer this question? Always, spirochetes, even in young children afflicted with periodontitis, we can observe the presence of amoebas. It is a very different scenario. Lots of activity, neutrophils. Certain situations may be very different. For example, this patient, who has excellent mouth hygiene. This patient presents very mobile teeth with 9 and 10 millimeter pockets, and advanced periodontitis. We can see the very active Trichomonas at the site of infection. Here are 3, with the spirochetes, a leukocyte, watch the activity. Observe the flagellum agitating them. Their presence is remarkable, especially when we consider the Trichomonas vaginalis being part of the same family, which are also treated by our fellow doctors by antibiotic therapy, while also considering treatment of the spouse in order to avoid contamination. Where is dentistry at? Are we going to allow this situation to continue without intervening? This patient has excellent mouth hygiene. In our opinion, conventional hygiene is not enough to eliminate this parasite. Notice the activity and the Trichomonas. Notice the flagellum. Finally, this is what we have after a typical therapy using local disinfectants and antibiotics. The before and after aspect of the gingival crevice flora. During the disease, we can observe the tremendous activity, the presence of amoebas, the presence of neutrophils. These are the characteristics of the periodontal disease. We notice that the amoebas with the white cell nucleus, which have been ingested, the neutrophils with the granules dancing inside. Of course, there are some bacteria, but notice the proportion of neutrophils and the proportion of the infection and parasites. Notice the activity during the disease. So this is the situation that we observe before treatment. Once treated, the patient will recover a flora much like the one of a healthy child, free from parasites. Always before. This is the same patient after being treated. You will notice the absence of neutrophils. the absence of very motile bacteria, and mainly the disappearance of parasites. This flora, according to our clinical experience, should be permanently maintained in order to restore the gingival condition. After a convalescent period varying from a couple of months to 2 years, we will be able to observe a substantial recovery, ceasing of the bleedings, the reattachment of the gums given that tartar has been removed. Avoiding reinfection is what is left to be done. For almost a century, we claimed it was an opportunistic and innocuous infection. I think it would be better to talk about parasitism. Until the contrary is proven, in our opinion, periodontal disease must be considered primarily as a parasitic disease with epidemiologic and infectious criteria comparable to intestinal amoebiasis or the genital trichomonas, and treated with similar methods recognized in conventional medicine. Thank you.